Laparoscopy is used frequently in the surgery for colorectal cancer. Many of the operations that we do for colorectal cancer now are the same that we did in the 1950s. The way they're done, though, is radically different, and they're done with smaller incisions, less pain, and quicker recovery. So there's been refinements of technology and technique to accomplish the surgery in a less invasive fashion. In the 90s, laparoscopy was the way we were doing it, mostly with smaller incisions using telescopic instruments, if you will. That is still done today in many cases. It's a 2D picture, and you're trying to do a three-dimensional operation. Now robotics is increasingly being used here at Reston Hospital Center. We are leaders in robotic surgery for colorectal surgery. We have one of the busiest robotic colorectal surgery programs in the East Coast, and this has led to further refinements of the technique with 3D, high-def, mini incision operations using highly refined instruments that articulate in ways that are just almost unimaginable and certainly cannot be done with standard laparoscopic techniques. So the operation is pretty much the same and the treatment is the same. The refinements have come in the technology and the minimization of minimizing the amount of pain and suffering the patient has post-op. It's also led to decreased length of stay in the hospital. 10 years ago, the average hospital stay was 7 to 10 days for colon cancer surgery. Now it's 2 to 4 days. So it's been very, very good.